For this OEC. So today will be recorded, just so you know that. And today we'll be presenting the second module of our two-part training session on the OEC 2021 rate card. The last session focused on introducing the rate card and providing an overview of each metric. Today's session, we're going to focus on the implementation processes, data systems, and the use of rate card payment funds. Today's meeting is being recorded for those to view later if you cannot attend today, or if you have to leave early or just want to rewatch it. And to the extent that you have questions throughout, please feel free to insert them into the chat. If we do not get to them throughout this discussion, we will do our best to document and answer these questions afterward. So now I'm going to turn it over to Danielle from SoFi.
Sounds good. So we wanted to just provide a quick update and background on the rate card again before we dive in. As mentioned, this session we focused on some of the implementation and data collection pieces, but just as a refresher, we'll be talking about these 4 metrics that are included in the rate card itself. First, the key population enrollment metric, which focuses on prioritized populations from OEC as well as teenage caregivers. And then the second metric is prenatal enrollment. This encourages early engagement with families early in their pregnancy. The third metric is caregiver education and training or employment. This metric is open to any caregiver served, not necessarily newly enrolled in home visiting after July 1st, and can be achieved 4 quarters throughout the year. And this metric is broadly defined to include education and training, as well as employment working at least 20 hours per week or graduation from an education and training program. And then last but not least, we have the prenatal and postpartum care metric. This focuses again on that crucial prenatal and postpartum period. Is open to any caregiver and is defined along several prenatal visits, 1 postpartum visit, and 1 well-child visit. So before getting into some of the data pieces, I'm going to turn it over to Ashley McAuliffe to chat more about some of the background on the rate card.
Awesome. Welcome back, everyone. My name is Ashley McAuliffe. For any of you who don't know me, I'm the Family Support Division Director with OEC. And so I am going to walk you through a little bit of our active contract management and rate card overview, which you will be hearing a lot more about at the end of the week. So OEC is going to be piloting an active contract management process for this contract cycle, which is outlined here in this slide. The active contract management process features 2 components, a compliance management and performance management. Compliance management is intended to track how efficiently OEC funds are being used and if contract deliverables are being met. Performance management is intended to track how effectively providers are meeting family and community goals, and tracking progress on the outcomes rate card will fall under the performance management piece of the ACM process. Questions on the ACM process can be directed to either the GPL team, who you will meet on Friday, or to your family liaison. Next slide, thank you. So the ACM, or active contract management process, will include 1-to-1 monthly check-ins between program liaisons and providers, as well as more formal bi-monthly regional performance meetings. The one-on-one check-ins are intended to be used to check in on progress toward contract goals and your organizational health. Rate card data will be discussed and verified during these check-in calls. During the bi-monthly regional performance meetings, program liaisons will convene providers within a region to do a deep dive into specific topics of interest, one of which could include discussed provider rate card data and performance. All of this is to say that rate card is one piece of the overall suite of activities to be included in ACM, and only one way in which performance will be assessed. Next slide, please. In order for rate card implementation to be successful, we expect providers to work internally to develop and execute on strategies to facilitate rate card metric achievement for metrics most relevant to your program, Ensure program data is being tracked and entered into ECIS in a timely manner with low error incidence. For instance, for the caregiver education and training or employment metric, information should be entered into ECIS up to 15 calendar days after the last day of the quarter. We expect you to attend meetings with your program liaisons to discuss implementation progress and performance management and share best practices with other programs. OEC's engagement is a critical part of ensuring that rate cards are implemented smoothly and efficiently. The agency commits to supporting providers. Analyze rate card data and administer payments in a timely manner. Payments will be administered every 6 months within 60 days after the end of the 6-month period. Hold monthly meetings between OEC program liaisons and providers to discuss implementation progress, answer general questions or concerns, and read out to providers on metric achievement. Serve as an ongoing resource to providers through the rate card implementation process and support with any logistical challenges that may arise. Seek out feedback from the home visiting network on rate card implementation. Next slide. Rate card funds can be used at your discretion based on what your organization allows, and we reviewed those this morning during our contract review. For instance, funds can be used for professional development opportunities, staff retreats, additional curricula, items for families such as baby gate strollers, books, and any other kind of emergency needs that families may need, but you would need to purchase those and then give them to providers or to families since we are not allowing gift cards. I'm not sure who's going next, so I apologize. I'm not sure who I'm turning it over to.
Thanks, Ashley. I think it's back to me.
Thank you.
So wanted to take a minute before getting into some of the ECIS pieces to hear from the network here on your impressions of the rate card, how you might kind of focus on some of the metrics that have been selected and how this might influence operations. I actually can't see the Teams chat, so feel free to add in anything in the Teams chat, but also would welcome if anyone wants to unmute and answer any of these questions, starting with the first one, which is, which of the four metrics are currently a focus at your organization or for you as a provider?
Danielle, I can start sharing if you'd like to.
Oh, that would be great.
Okay.
So if anyone wants to offer up any ideas, curious how some of these metrics land. Which one might be a challenge, for example, versus more squarely within your model.
There's one comment in the chat, Danielle, that said, or two now, that says all 4 are their focus. And there's another one that says NFP can only enroll prenatally. Another one says all 4.
Yep, so seeing that quite a few of these are focuses for different providers. There can be complications with enrolling prenatally. On the prenatal enrollment piece, I'm curious if there are, upon reflecting on the rate card or maybe just the overall procurement as a whole, if there are specific strategies at the referral or enrollment stages that your organization is thinking about to continue to enroll families prenatally. It looks like have focused on prenatal enrollment. And depending on where you are in Connecticut, reaching priority populations can be a challenge. And on that priority population piece, are there any maybe specific strategies that any of these organizations have started to think about to continue to reach those priority families? Or I know we've been talking a lot about the prenatal enrollment piece, priority population piece. I'm curious on the third metric, supporting education employment goals, if there are specific strategies, particularly now as we kind of recover from COVID and the economy has taken a hit because of that, if there are specific strategies that you've started to consider to help support families meet those goals, if that are their goals. Okay, so seeing some helpful comments here. Maybe if we also just move to maybe the last two questions. Again, most broadly curious if there are any operational strategies that your organization is thinking of across any of the four metrics. And then as you move towards some of those shifts, what might be helpful from OEC and supporting implementation? I know these are very broad questions, but curious if there are any general thoughts that you want to drop into the chat. Well, maybe we'll, Ashley, maybe we'll move on to the following slides. I can turn it over to Connie to walk through some of these pieces, but if folks have other questions or things they want to add into the chat as they think about those questions, feel free to do so.
Hi, folks. I'm going to talk us through the ECIS portion of this. So, as Danielle and others have described, we've got these four metrics, and then the question is, where exactly do you put that in ECIS so that it's properly reflected in the rate card reports? So that's what we're going to go over in the next few slides. Before I jump into them, I just want to say two quick things, which are we're about to jump in and look at a bunch of screenshots. And for experienced users, these screenshots are going to look totally normal. You're going to go, yep, I've seen it a million times, I'm good. For new users, I just wanted to say, don't worry, we're going to have a full ECIS training. I think it's a week from today on the 21st. So, we're getting, this might be feeling like we're getting a little bit ahead of ourselves, but rest assured, we're going to go through, you're going to get the full ECIS training, and, these screens, once you get into it, these screens will look familiar to you too. I also just wanted to mention that all these screenshots are in the rate card guide. So no worries about, trying to quickly absorb everything. It's all documented, and it's all in that rate card guide that I believe was sent out already. If not, it will be. So having said that, we'll go through each of the metrics, 1 through 4, and kind of just talk through where you would put the relevant information in ECIS. So the first one is the key population enrollment. And just as a reminder, this one is about those key populations being Black or African American caregivers, Puerto Rican, Native American, and younger than 20. So in terms of how to get that into the system, the good news is you're doing it already when you enroll caregivers. There's not much new here. The date of birth. So on the screenshot, you can see the date of birth is circled, and that's how the system knows, how old the caregiver is. When you enroll them, it's going to compare that date of birth with the enrollment date to figure out how old the caregiver is. And then on the enrollment form is where we've been entering, race and ethnicity, all along. So, there's the race, there's the ethnicity field. We did add the new Puerto Rican dropdown. And the way that works is if you choose yes for Hispanic Latino, it's going to pop up Puerto Rican yes, no. That's what this screenshot shows. If you had chosen no, you wouldn't even, for Hispanic ethnicity, you wouldn't even see Puerto Rican. But again, all the date of birth, the race and ethnicity, they're all part of your standard, enrollment process. You literally can't miss it, right? These are required fields, date of birth, race and ethnicity, they're all required. So just in the course of enrolling your caregivers, you're going to be entering the information that's needed for this first metric. So for the second metric, just as a reminder, this one is about getting caregivers who are, relatively early in their pregnancy, specifically before 32 weeks gestation. So again, kind of the question is, well, how does the system know that? Well, the system knows that when you enter the baby's due date, otherwise known as the estimated date of delivery, or EDD for short. And that's what you see circled on this screenshot. The field index child is also circled because when you enroll a caregiver, either the caregiver is prenatal or the child's already been born. So the other option in that index child dropdown is child has already been born. Right? But in this case, we're enrolling a prenatal caregiver, and it's going to ask you to put in the estimated date of delivery or due date. And I'm glancing at the chat. I'm going to it's hard to keep an eye on the chat. So I'm going to go and maybe ask Ashley, both of the Ashleys or Danielle to interrupt me if I should be addressing something sooner rather than later, because I can see it looks like things might be popping up. Okay, oh great, perfect. And this slide, we're still on the second metric, looking at getting a caregiver that's fairly early on in pregnancy. And what this slide shows is that in the previous slide shows that you get that information at enrollment, right? It's right on the referral form. And you may or may not have noticed there actually wasn't, EDD is actually not a required field. We would love it to be, but we didn't, because we know there are times when you might not get it right at enrollment. You might know that the mom is pregnant, but for whatever reason, you might not at that moment, of the referral information, you might not know the EDD. So you get what this slide shows is that you can add that in after the fact. And the way you would do that is in the mom's record or dad's record under the health and wellness tab. And we've added this new pregnancy and postpartum information table, which is what's circled there, the pregnancy and postpartum. What's circled is that's the link where you would click that, and it would bring up the table that's shown below. And you would click add pregnancy, and it would pop up to the right. And that's where you would add the EDD. We hope the sort of usual course of business is that you would put in the EDD right at the get-go, right? Like when you're enrolling. And if you had done that, that EDD would fill in this table automatically, right? I took a screenshot where it wasn't there, but the sort of happy path is that you would know that EDD and it would populate this table automatically. But we did want to say that no worries, if you don't know it, you can still enroll the mom or dad, and you can go in and add that EDD after the fact. So that, and I think that covers, yep, good. That covers the second measure. The third measure is about employment and education. And just kind of by way of kind of reminding and orienting, the third metric says, did the caregiver enroll in an educational program or stay in an educational program? Or did they graduate? Or did they become employed or stay employed for at least 20 hours a week, right? So any of those would be considered achieving the metric. So we'll take them one by one here. So if the caregiver enrolled or stayed enrolled in school, that would be educational status. I'm actually going to make my screen a little bigger because that is awfully small. Bear with me for 1 sec so I can be sure I'm looking at the slide correctly. Okay. Oh, thank you. Oh, that worked even better than I thought. Thank you. So, and again, these are all in the rate card manual. So if you're having trouble seeing it, just refer right to that manual. It's I believe it's exact same screenshots. So educational status, that's where it's student or trainee or not trainee. That's, where you would choose student or trainee. And then you would also have to fill in the date educational status verified or updated. And reminder there that this is all self-report. When we say verified, we don't mean, did you check with the school to make sure, we don't mean anything outside of, a conversation that you had with the caregiver. So that's one thing to note. And the other thing to note is, we've gotten questions about, well, what exactly is that date? Like, is that the date of the home visit, or is that, is that the day school starts, and really what that is the most recent date where the home visitor can be sure that the caregiver is in school. So, and very often it is a home visit date. So if the home visitor had a home visit last week, and they had a conversation, yes, you're enrolled, great, how's it going? Okay, that date verified could be the date of that home visit last week, because that was the date on which the home visitor could confidently say, I know this caregiver is in school, right? And it doesn't have to be a home visit. It could be, we have other versions of, like it could be a resource drop off, it could be a phone conversation, but it's kind of like the last contact that the home visitor had with the caregiver in which they were sure that they were enrolled in school. So I hope that's clear. I'll say one other thing about that date, or two things, I suppose, which is that date has to be in the quarter, right? Because we're looking at each of these outcomes on a per quarter basis. So that date where the home visitor said, yes, I'm sure, this caregiver's in school, that date has to be in the quarter. So I know we've very often gotten the question, how long do you have to get your data in ECIS? And the answer is, 15 days after the close of the quarter. But be mindful that the date itself has to be during the quarter, right? So don't wait till 2 weeks after the quarter and say, yep, as of today, I'm sure they're enrolled. Well, you got to be sure they're enrolled during the quarter, right? You have 2 weeks to get that information in, but the date itself has to fall during the quarter for it to qualify for this outcome. So that was kind of a long explanation of the student trainee. So whether they're student or trainee, the next is graduation date. That's a lot simpler. It's just that the graduation date needs to fall during the quarter. So that's pretty self-explanatory. ESL is also, the same thing. Is the caregiver enrolled in ESL? And if so, tell us, what's this kind of the most recent status? Like, at what point were you sure that they were enrolled in ESL for that verified updated date? And then I believe employment is on the next slide.
Hey, Connie, before you move on, I'm just going to call out some questions in the chat here. So one from when you were talking about ongoing enrollment in education, there's a question that says, doesn't that date have to be verified after the end of the quarter? And I think what you're saying is no, not necessarily, but maybe you can address that.
Yes, thank you. It is no. It can be entered at any point during the quarter. It's I hope this isn't, I'll say this, I hope it isn't more confusing, but we actually used to, previous iterations of the rate card did have that condition that you had to update stuff at the end of the quarter, and that's no longer a criteria. So it's exactly what Annie just said. It does not have to be entered after the close of the quarter. It's just that it can't go beyond 2 weeks past that. So we do give this kind of grace period of, okay, you talked to them on, September 28th, you didn't get around to entering that information until after September 30th. Okay, you've got 2 weeks to get that in. So that is sort of almost, think of it maybe more like a grace period to get that information in the computer. But yes, to confirm what Annie said is absolutely right. It does not, it can be entered at any point during the quarter. I hope that explained it.
Connie, I have a question. I'm sorry. I just want to further clarify that.
Yeah.
So, you know, our network, we back enter for our subcontractors.
Yeah.
So say that we don't hear from that person, we hear, you know, we get the update on September 15th, but we still don't enter it until October 15th or by that October 15th date, because that's what we've been accustomed to. Will we
Yeah.
still get credit for the quarter? Is it going by
Yes.
creation date or back or the date that we enter into ECIS?
It's looking for the date that is actually entered. So, I think if I understood right, September 15th is the date the home visitor said, yep, I know as of today that that caregiver's in school. So that September 15th date, which is the one that's actually entered in the computer, right?
Yep.
That has to be during the quarter. And you're right, Thais, like the date stamp, it is looking to make sure you entered that within 2 weeks. So the date stamp that's associated with that September 15th entry does have to be by October 15th.
Got it. Okay.
That makes
Is
sense.
that going to be, is that the, yeah, no, it makes perfect sense. It's helpful for us to understand date stamp versus just because of our practices. Is that the case for everything? Is that?
It is. And that's one reason I kind of got into it a lot under education, because it is the same for each of these verification dates.
Thank you.
And, but again, the other thing is, depending on your practices, again, this can be entered at any time. Like if it made sense, you could have a practice in your agency where you do it during the month of, what is it, July, August, September is the quarter. You could do it during July for that quarter. You don't need to wait till September. So again, any entry during the quarter is going to suffice to, for the rate card outcome.
Is the exception the child's injury and maltreatment? Is that still is that the only area that still can be verified after the quarter's over?
Yes, it is. It is. And that's not just so that we don't confuse folks, that's not related to rate card.
Correct.
But yes, you're absolutely right. For that, you do have to wait until the quarter actually ends, because in that case, what you're verifying concerns the whole of the quarter, So that's why you've got to wait to the end of the quarter. By definition, you kind of got to wait till the quarter elapses before you can say something is true for the entire quarter. And that's why you have to wait till the first day after the quarter.
One more question on this, I promise.
Yeah.
Well, for now. With these verifications, say that I updated once a quarter and there's been no change. You're still looking for an update every quarter for like the caregiver education and training, correct?
Yes.
Okay.
Yes. So because if you did it in January, that's going to cover you for rate, and I'm just talking rate card now. That's going to cover you for the January, February, March quarter, right? Because they're employed or in school January, but then come April, May, June, that quarter, it says you need to show me again that they're still employed this quarter. So you need another date that falls in that quarter.
Got it. Okay.
Yeah. No, thank you, Thais. Those are great questions.
Can I just ask for clarification? This is Dee.
Yeah.
So I feel like this is a little bit of a shift from what it was before. I just want to make sure I heard right.
It is a shift. Do you mean specifically that the verifications don't need to be done at the end of the quarter? In terms of this shift?
Guess I'm lost.
Dee, if you're talking, you're muted.
The thing is, I'm not.
Oh, no, you're not. I hear you.
Okay.
You're muted on the screen though.
Oh, that's so weird. Can you hear me?
We
I
can.
can hear you.
Okay. So I think I'm hearing the only thing that has to be done between the 1st and the 10th at the end of the quarter is the maltreatment and injury. Everything else has to have a date sometime within the quarter.
Yes. And it's so hard. I want to be clear. It's so hard to talk about this stuff and try to be clear. Everything you just said is true. And I would add, it's possible, not required, but possible to enter the rate card information after the quarter ends for that 2-week period. So it's not a requirement, but it's, again, think of it like a grace period. It will recognize information that you enter after the quarter closes.
But you would be entering dates from the previous quarter, not for
exactly
that's
right.
October. Okay.
Exactly right. So in other words, the September date that's entered in October. That's exactly right.
Got it. Okay, thank you.
Okay, sure.
I know Ashley is hitting a lot of the questions that are coming in the chat, so thank you, Ashley. But there was one that got buried a little bit that is related to this. It was just, can you use the last date of the month in which the quarter ends? And I think that is the date that you're supposed to be using is based on whatever is actually happening in the context of your visits or your communication with caregivers. So if that last date of the quarter happened to be the date that you last had contact with a caregiver and confirmed their education status, then that date is eligible and would very much meet the metric, but we wouldn't enter that date as a sort of stand-in for a different date if that interaction occurred earlier in the quarter. Did I get that right, Connie?
Absolutely. Yeah.
So yeah, someone just wrote in, so enter as you go and verify at the end of the quarter. Correct? Question mark, which I think is a pretty good summary.
But you don't really have to verify at the end of the quarter. If you, for the quarter July to September, if you enter July 15 that your caregivers, in school or working, whatever, because both will qualify, if you enter, yep, that's the case, July 15, you're done. You don't have to go in at the end of September to do it again. Exactly. Enter as you go is your verification. I just saw pop up. Yeah.
And I think this is the slide you're on, Connie, correct? Or did we do this one already?
Yes, no, this is great. Thank you. So hopefully that covered the verification questions. I'll let Annie or the Ashleys jump in if other stuff comes up that I'm not seeing. So we'll get back to I'm distracted. Actually, there are more questions. I'm not sure if we should take these, but I'm only seeing small snippets of them. If the mom, I'll grab this because I'm seeing it. If the mom no longer has a job at the end of the quarter, it still counts. It's if you were employed at any point during the quarter, it would count. And I apologize because I'm having limited view of the chat. If the Ashleys are already answering these, maybe I should go on ahead. Is that what I should do, Ashleys? Should I just go on ahead, or do you think you have the chat covered?
I am trying to. I'm answering via my phone because I'm sharing my screen. So,
And I'm trying to answer as well, but we did find in the last meeting that reading them out loud and everyone hearing the answers was helpful.
Okay,
and,
so
and talking about it while we're on it.
Right.
Okay. So let me view the chat here.
Connie, do you want me to read them out?
Sure. And actually, I just turned it on. I was trying to look at too many screens, but sure, Ashley, go ahead.
So if the status changes during the quarter, does any metric verification count?
Yes.
And will the rate card report capture that? Ooh, I'm not sure what this is referring to. I'm sorry. If at the end of the quarter it says unemployed. Karina, you might. Oh, go ahead.
I see it now too from Karina. It will capture. So in other words, if they were employed and then unemployed all within the course of a quarter, it will capture both, because every time you make an entry, it kind of logs that entry. You the user only sees the most recent entry, but it keeps it in the background. But like I said, the good news is any employment of any duration counts. So if it's the case where, mom is employed in June, or where the quarter begins, I guess, July, mom is employed in July, loses the job in August, that still can, and Sophie, please correct me if I'm wrong on any of these points, because this stuff gets hairy. But my understanding is that counts. So yes, the system captures multiple entries and it kind of keeps track of them all. But the system is only looking for evidence of employment or student matriculation once. So if you've got it, if they were employed at all or in school at all during the quarter, it counts, quote unquote, for rate card.
And for that, we are all caught up on questions for the moment. I'll
Okay.
raise my hand when they start coming in again.
Okay. Well, and I turned it on too, so I'll be a little bit about that. Sorry about that.
I had a question about whether the other categories in the ECIS record needed to be updated, like usual source of medical care, dental care, or health insurance, or do you verify those once and you're done?
Those are quarterly, and we do think of them as being at the end of the quarter. But I suppose you could do it at the beginning of the quarter if that's your preference. But yes, those we do. I believe that's in your contract to update those, all the demographic information quarterly.
And it can be any time in the quarter, not at the end of the quarter.
My only hesitation is I'm not as familiar with the contract language. That's my only hesitation. So maybe
The contract just says quarterly. I think best
Okay.
practice might be at the end of the quarter, so you can reflect on the past quarter, or at the beginning of the next quarter, reflecting on the past quarter. When you go through the benchmarks training, you'll understand that it kind of reflects 2 points in time. So we want it to be consistently 2 points in around the same time, whether it's the end of the quarter or the beginning.
I hate to be a pain, but it might be helpful to have some, and maybe this is already in these slides, what needs to be verified during the quarter and what needs to be verified after the quarter, like some sort of quick reference guide. I mean, I have it in my head now when I go to do the actual end of the quarter report. I know I'll be thinking, I'm taking notes, but I think it just might be helpful to have some sort of guide because everyone has a different timeline. Does that make sense?
Yeah, thank you, Leora. We will think more about that. Yeah. I mean,
We have the data collection measures by enrollment date and child's age that identify which needs to be updated quarterly, but perhaps if we want to add rate card to that, I don't know if that will be too confusing for some people. We can have two separate versions, maybe one just for benchmarks and demographics, and then another for a combination or something. We could think about that, Connie.
Yeah, that schedule you Ashley just mentioned does have on there that all demographic information should be updated quarterly. It actually does include that, and it lists out the demographic information that should be updated quarterly. So it actually is on that document already. And this iteration of rate card is even easier. This iteration says if you update everything at the end of the quarter, you're good. Or you can even update it as you go, in which case you've done your work, you're already done. By the time you reach the end of the quarter, you're already done in terms of education and employment. So yeah, we thank you, Lara. We will think more about that, but it is on those two data schedules. One is by enrollment timing, one is by child's age. There is at the bottom of that, there is a reminder that demographic information should be updated quarterly, and I believe it lists out the fields. Go ahead, Dee.
So I understand. I was looking at that form right as we were talking.
Yeah.
And it does say at the end of the quarter. So I guess the clarification that some of us might be looking for is, does that mean before the quarter ends? Or in the past, we were doing it after the quarter ends because that was what we thought we should do between the 1st and the 10th of, say, October, because that's the next one that's hitting us.
Right.
But what I'm hearing is we should maybe be doing it before September 30th.
I can give you.
Sorry.
No. I'll sort of give you my answer, and then maybe others can chime in. I think truthfully, anyway is fine. As far as we're concerned, we just want to make sure there's a quarterly eye on it, right? Like whether it's the beginning of the quarter, the end of the quarter. End of the quarter is preferable. And I guess the other thing is, as Annie was describing, what these verification fields really mean are, as of this date, I'm sure this is the case. So as Annie was saying, if you happen to have a home visit in the last week of the quarter, then that timing works out great. Yep, as of last week, I talked to them. I know they're working, and you got the employer information and whatnot. So if it happens to, if that home visit happens to be at the end of the quarter, then that all coincides. But what we're saying is you don't have to wait. Right. And I think what might be a little confusing here is that we are asking you to update demographic information in addition to rate card, right? Because if you look at that sheet, it's, you know, it's other things like health insurance status and a few others that I'm not thinking of off the top of my head. So I guess maybe what's confusing is there's sort of this set of demographic fields that we've always said, please update that at the end of the quarter, and that still holds. And if you did it for rate card, that would hold too. But what we're saying is you kind of have options now. You can do it earlier. And it's really whatever works for you. If you want to wait till the end of the quarter, that's fine, but you might have to sit down with your home visitor and think, okay, when did you have that last home visit? And were you sure they were working? You know, whereas we were thinking it would be easier to do as you go. You know, like anytime during the quarter you verify this employment education, just do it right then and there, then you're done. Does that, I don't know, does that help?
It does. When we run the rate card, the results for the, well, it won't be the rate card. I'm not sure what it is, but one of the things that we run allows us to know if we qualified for that measure. Is that running well now?
Not yet. The developers are revising the rate card reports. There were two. One just showed who's eligible and who attained it. And the second one put the dollar amounts for the billing. And they've had to really completely revise those with these new metrics, and the developers are still working on it. So like if you go into ECIS right now, there are no rate card reports because we took down the old ones because they would have just been confusing since they don't apply anymore. And they're still building the new ones. But you're absolutely right, Dee. There will be two in the future. There will be two rate card reports, just as there have been in the past. One shows, you know, how many are eligible for each metric. And then how many achieved it. And then the second one will put billing amounts to it. So yeah, folks will be in the denominator. So if you have, you know, for like the denominator for the preterm births is going to be all births. Now I'm using the wrong example. I'm using a benchmark example of I meant preterm enrollments. It would be all enrollments. So those folks would be in the denominator. Because I feel like I'm going a little far off in left field.
I think, no, I mean, before it wasn't working terribly accurately, but it sounds like it will be, and that'll help.
Yeah. Yeah, they're working on it.
Perfect.
And kind of before you move on, just to reiterate from if you did not attend rate card day 1, that the rate card now, the caregivers do not need to be enrolled the entire quarter to be eligible for rate card. So that's something to note. And then the grace period for backtracking your rate card data is, I believe, 15 by the 15th of the following month, or is it the 10th?
I think it's the 15th.
I think it's the 15th. We tried to keep it easy.
Yeah,
It's the 15th.
Yeah. So it's by the 15th of the following month, you can backtrack your data to the date within that quarter. Okay.
All right. Okay. So back to the employment slide. So this one, or should I pause? Let's just grab this question before you go on. Back to the enrolls before the bill, we discover she's further along than we thought. Are they still eligible? Why don't we get back to you about that unless Annie or Danielle want to address it. The question is, if a caregiver enrolls before 32 weeks, but then we discover she's further along than we thought, are they still eligible? I don't know if
it's a really good question. I don't want to give a off the cuff answer that that we haven't fully thought through. So we'll add that to the list. We will circle back and answer it.
Yes, thank you, Annie. That was my thought exactly. Where are we in the developers, the process of transferring data and programs that switched? Believe it or not, that's already, this is Lisa's question about where are we in terms of switching models. They've actually put that utility in, but we haven't, quote unquote, pushed it to production because it would wreak havoc with the reports. So we're waiting until they can restructure the reports and make sure the reports will work right before we put that capability to switch models. So there's a lot. So we're getting there. There's a lot to it is the answer, and it's ready to be turned on, but for that we want the reports to work correctly as well. Okay, I think we're got. Oh wait. Do we get an extension on the reports? Oh, let's talk offline about that, Lisa. Let's
And-
talk.
From the contract session this morning, if you refer to the contract language, you're allowed one extension per type of report. However, you can always run these reports under your old model, and we can make a note in the body of the language that, you're now HFA, but we had to run these as PAT or whatever the case may be. You can still log in under your old model and run reports.
Yeah, I think it's going to be like that. I think it might be, that your caregivers just will be listed as the wrong model. And I think it's fair to say, Ash, we wouldn't expect agencies to use if I understood, they get sort of like one free pass. Did I understand that right?
They're allowed to ask for one extension per type of report, which brings up the question, if they're verifying, existing caregiver, not verifying, maybe verifying, updating employment information on existing caregivers, but they're under PAT and now they're HFA, they should be updating that in the family's record under their old model, correct?
Yeah, there's no choice, I don't think. I think that's the only way to do it. And yeah, because once the switch is made, the switch can be backdated. So it's just going to look like family is in PAT, and then at a certain point when we flip the switch, it'll be like, oh, they're an HFA family and have been since July 1st. So it'll all work retroactively.
Mm-hmm.
But I was just going to say, I don't think we would expect agencies to use their sort of, repass because a report issue isn't working on our end. I think we'll work with agencies to make sure that we understand the reports as they are and notate them as needed. I don't think we would expect agencies to kind of, use that one because we don't have it working yet.
Yeah. Going back to questions in the chat, do prenatals need to be fully enrolled before 32 weeks, or does it go by the date of consent? For example, if we provide phone support until a space opens, but they aren't fully enrolled until after 32 weeks, do they count?
It goes by enrollment date, which, as you know, is the date of the first home visit.
Mm-hmm.
So that's where it lands.
Is it required to put caregiver's employer to receive rate card, thinking of undocumented families that do not want us sharing that information?
No, and thank you for asking that, because I wanted to comment on that on this slide, that you can enter very generic information, in the instance where if a caregiver really does not want information documented, you could enter something like, employer in the employer in that field. Or a generic industry, like childcare or landscaping, or, you could enter something very generic. We obviously we want the best information we can, so please don't do that for everyone. But absolutely, if you have a caregiver where that's a sensitive issue, you do not have to be specific about the employer or about the job title.
Okay, and that's it for the chat, so we can move ahead.
Okay. So actually, that was, I think, what I wanted to say about this slide. Yeah, I think we covered it all. So it's employment status. That's obviously employed full-time, part-time, or not at all. And then that date verified, which we talked about, the name of employer, job title, and number of hours per week. Just to note, that has to be at least 20. Yeah, and I think we covered it then. I think we covered this metric. So the fourth metric, just again, kind of by way of orientation, requires 4 things. It's that the caregiver has to be enrolled before that 32-week gestation point. And then there are 3 types of healthcare visits. There are the prenatal visits, of which there should be 3 at least. There's the postpartum visit, and only needs to be 1, and then there only needs to be 1 well-child visit. So this slide shows I think the first 3 of those, namely the again, that whether a caregiver is 32 weeks along or less, that is again based on data delivery, EDD, which is if you can see, like in that table, that's again that filled in from that referral form, or you can add it afterwards, the estimated data delivery. So that covers how the system knows the week's gestation. For the prenatal visits, that's that prenatal care column with that visit button circled. If you click on the visits, that's where you can enter prenatal care visits. And then for the postpartum information, there are two fields in this table, the appointment, and then I think that's a date there. I'm having trouble seeing it because I just shrink things down. But thank you. Yep. So it is the date. Yes, it is. So it's the postpartum appointment, and I believe that's yes, no, and then you would enter the date. The time frame on the postpartum is that it should be within 8 weeks after delivery. And the way you enter it is that edit, where that edit is circled. You just click edit, and it brings up a little pop-up. And that's where you just enter, postpartum appointment, yes, and what the date was. So it really super, super simple. So that covered the EDD requirement. This slide, in other words, illustrates the EDD requirement, the prenatal visits, and the postpartum. And then I believe the next slide shows where you would enter the well child visits. All of you who are experienced users totally know this field is in the child's record. Under their health data, this is where you would enter, that their well child visits. It's for new users, I suppose, it's populated based on the child's birth date. So, and it's populated also based on the AAP, American Academy of Pediatrics, the recommended well visits. So like in this example, the 3 to 5 days, the system looks at the day the baby was born and calculates out when would a 3 to 5 day window be. Similarly, the 1 month visit, there's a 1 or 2 week span where the AAP says this is when that 1 month visit should happen, and that's what that visit window is about. It says this is when you should try to get that 1 month visit in. So back to rate card. Rate card looks at the date of this is where you enter the child's well child visits, and the rate card looks at those dates that are entered. And the rate card simply looks at whether there was at least one well child visit within 8 weeks of delivery. Okay, so this is an instance where it's slightly different from the benchmarks. The benchmarks are looking at, did the visit happen during that window? The rate card just simply says, we really want to see that the baby, gets to a pediatrician within 8 weeks. And if the baby has a pediatrician visit within 8 weeks, we're good. That's, that's going to suffice for the measure. So that, and again, that's the fourth of, or the third of the 3 types of appointments that are needed for that measure. So, and I think that covered it for ECIS. If there, maybe we'll just give a sec for any last questions, and then we will hand it over to Law, I believe, for next steps. For number 4, I see for number 4, if enrollment is after 32 weeks, do any of the visits count? They do not. So in other words, being enrolled prior to the 32nd week of gestation is a requirement. So if that first requirement isn't met, then the child or the family isn't eligible for that metric. So, they count, they're good, of course, we'll be collecting that information, but in terms of rate card, it would not count. One of the 4 I was calling for this, I assume you mean, Jessica, the last metric 4, I was calling being enrolled prior to 32 weeks, one of the requirements. So if you're talking about metric 4, it was being enrolled prior to 32 weeks. And then there are 3 kinds of healthcare appointments. One is prenatal visits, one is the postpartum appointment, and one is a well child visit. Did that answer it, Jessica? Hopefully, maybe Jessica, yeah. While Jessica's thinking, Lisa, what quarterly report template do you mean?
She's referring to their program report, and it was included with your contract in the policy manual. And if you don't have that yet, we can send that out before we, soon or now. And you will definitely get it with the policy and procedure manual. That's part of that.
Connie, can you explain how it works for a existing enrolled caregiver who may have been enrolled prior to July 1st to the new contract, who is currently pregnant, but the baby is not the index child? Can you just review what you said about that before?
Yeah. I have to think because it's hairy.
Sorry.
There are two measures that look at whether the caregiver's prenatal, right? I believe it's measures 2, which looks at prenatal, like it's almost like recruitment and enrollment, and then 4, which we were just talking about. So for measure 2 is really looking at new enrollments after July 1. So if they were enrolled after July 1, they wouldn't qualify for measure 2. As far as measure 4 goes, they might qualify. And I'm gonna say what I think, and I'm gonna invite Sophie to confirm or deny. But my understanding is that the subsequent children would qualify for measure 4, assuming you tick all the boxes. They would have to get all those the prenatal visits, the postpartum, the well child visit, right? So assuming all those requirements are met, second children would qualify as long as, again, this requirement, they were no more than 32 weeks along. And I believe that would be as of July 1st, right? So in other words, if you got them 3 months ago, but they're due next week, we might have to get back to you on that in FAQ, but I believe that wouldn't qualify. I believe they would have to be that early gestation as of July 1st.
And you would have to add the child or enroll them, Connie, so you can add the well child visits in.
Right, exactly.
Can it be a sibling? Like, can a sibling count?
Yeah, my understanding is that siblings count. And exactly, you would have to add them as a child in ECIS to to enter all the information.
So D has a really good question in the chat, and it says, for benchmarks, if a child is in the NICU for the first 2 months, we don't necessarily know when the well baby visits occurred. Since the child is in the hospital, can we assume the visit occurred, and how would we report this?
That is a really good question, and I would say let us, for some of these questions, I think it's best if we kind of put it in, think about it, talk about it amongst ourselves, and put it in writing. Thank you, Dee, for bringing that up. And why don't we add that to the FAQs so we can be sure we, give a complete answer. How is prenatal loss handled? It's handled, I can tell you, it's handled in the data entry in that pregnancy and postpartum information table that where it says birth outcome. I don't know if you can see it on the slide. It's the lower table. Yeah, thank you. Just where it says birth outcome in real life. Or what I mean is in ECIS, that's a drop down. So if the screen looked like this, and the baby, well, this due date is come and gone, but if you had an upcoming due date that was in the future and you've been filling out your prenatal cares, if there was a loss, you would enter under birth outcome, that it was a miscarriage or fetal death or abortion. So there's a place to put it. I'm not sure if you're talking about sort of how you enter that information or how it's handled in terms of rate card. I think we should add that to the FAQs in terms of how that's handled in terms of rate card. And then I see the question, are you talking about newly enrolled families with more than one child or second child in an already enrolled family? We were just now, a few minutes ago, I was thinking of the scenario of the second child in I thought Leora was asking about a second child in an already enrolled family. newly
Yeah.
enrolled families with, okay, with more than one child. I
So
guess I'm not sure what the,
Yeah, so measure 4 can be on an already enrolled family where the pregnancy is occurring. So they can have other children as long as the mother's pregnant and you plan on entering that child into ECIS, even if they aren't becoming the index child. Measure 2 is only on newly enrolled families who can have other children, but they're new to you.
I hope that answered it. And then I also see well baby visits usually or often occur within a few days of discharge from the NICU. Oh, observing for the transition to home. So I think that goes back to the NICU question. Okay. So I think we might really be at next steps.
Hi, everyone. I'll be doing the next steps going forward. Connie, you did an amazing job of answering the questions. I learned a little bit of something today, which is always nice. So the next step that we're going to be going forward is with your feedback and the survey that we sent you previously. That is due back by Wednesday, September 22nd, 2021. And that was on the first session of the rate card.
La, somehow you got muted.
Thank you. I did get muted. Basically, we just need the information regarding the survey feedback from your first rate session that we had already on September 9th. And then we need that before September 22nd, 2021. And then these are the last steps. I'm the closer out of today's session. Do anyone have any last questions? Because I see a few hands are still raised. I don't know if Connie already had answered those questions or someone else have some more questions that need to be asked. Lenora, do you have another question because your hand is raised? I want to make sure that we answered your question. And already we put the second survey already in the chat. Thank you, Lisa, for your comment. So I know this session was supposed to be ending at 3, but I guess we'll give you back some more time if you don't have any more questions for us. Okay, thanks everyone. Have a wonderful day.
Bye.
Bye, guys.
Bye-bye.